Switching gears, I want to provide a comprehensive update on our vaccination campaign. A total of 86,315 doses have been administered in Rhode Island. 64,435 first doses and 21,880 second doses. As I have said in past weeks, we are overall in a good place and have a strong system in place. The CDC continues to publish rankings for states for doses administered. Rhode Island is close to the national average for total doses administered per capita, and we are just outside the top 10 nationally for second doses administered. While we all want as many doses as possible administered as quickly as possible, speed is only one of the measures of success we have prioritized. In addition to how many people you vaccinate, who you vaccinate matters. And that's what distinguishes Rhode Island and how we're taking this thoughtful approach. Right now, we are being very strategic in who we are vaccinating, primarily because we have the very limited supply. There are specific aims to the first phase of our vaccination campaign: ensuring the stability of the hospital and healthcare systems and protecting the residents of nursing homes and other congregate living facilities. That means going to each nursing home and each assisted living facility in the state. That also means working through employers to get emergency medical services personnel and public safety workers scheduled for their shots. That also means getting very specific types of outpatient healthcare providers vaccinated. When you bring vaccine to people in congregate settings, and when you coordinate vaccination through people's employers, that takes a little more time than just opening a large clinic at a public site somewhere. But we recognize that because it accomplishes our goal of making sure that we have a hospital and healthcare system for people when they need care. And it accomplishes our goal of protecting people in the congregate settings that have been most devastated by this pandemic. On the issue of timing and how quickly doses are administered, the good news is that we are very close to starting the portion of our vaccination campaign that will focus primarily on age. This approach is much less complicated and means vaccine will get administered more quickly. Starting this weekend, some limited vaccination will be happening for people who are 75 and older at our 5 regional clinic sites. That's roughly 5,000 doses. We have an emergency registry at the Rhode Island Department of Health that people can sign up for to indicate that they need extra help during an emergency. That already existing list is primarily being used to do this initial vaccinating. The people in the registry will be getting contacted directly. We expect that within 2 weeks, additional people who are 75 and older will be able to start registering. We already have started with 75 and older. A certain proportion of that population has been vaccinated, and now we will continue to roll out what's needed to get the remaining 75 and older individuals vaccinated. To be clear, older adults do not need to take any action right now to schedule appointments. For the vaccinating starting this weekend, people on the emergency registry will be getting contacted. For the additional vaccinating that will be happening, we will be doing very broad messaging through the media and community organizations so that people know how to sign up. After we start vaccinating people who are 75 years of age and older, we will look to the next phase of our vaccination campaign. This next phase will likely start in mid-February if we are continuing with the current level of vaccine supply. While the first phase of our campaign was focused on ensuring the stability of the healthcare system, making sure that we would not be overwhelmed and able to handle it, as well as protecting the residents of nursing homes and other congregate settings, the aims of this next phase are to protect those most at risk for hospitalizations and death from COVID-19. This is a critical point. The vaccines have been shown to be effective in decreasing hospitalizations. We want to make sure that we are targeted in getting at the individuals who are at highest risk for both hospitalizations and for deaths. We need to do this so that we don't overwhelm our hospital system and can more aggressively reopen our economy. We want to use our vaccine supply to prevent the most hospitalizations possible. We also want to use it to prevent the most deaths possible because we know how important each life has been. And ultimately, by doing so, we will be using vaccines in our approach to get the economy fully open again as quickly and as safely as possible. With that in mind, we looked carefully at national recommendations and did a careful review of Rhode Island data on hospitalizations, deaths, case rates, and chronic conditions. This was done in consultation with Rhode Island's COVID-19 vaccine subcommittee. Those members have been committed, fully engaged, and excellent. The approach we are taking is 100% grounded in the science and the data on how to best protect people who are most at risk, keeping them out of the hospital and keeping them alive. The framework we are using is based on 3 criteria: age, high-risk conditions, and geography. When the next phase of the vaccination campaign begins, vaccine will be available to all Rhode Islanders who are 65 to 74 years of age. Keep in mind that many older adults will have already been vaccinated. We have been vaccinating in nursing homes and assisted living facilities for weeks, and vaccinating will start soon for people who are 75 years of age and older, and that availability will continue. Going forward, age will continue to be the primary consideration as more people become eligible for vaccine. If you can post the age timeline graphic on the screen, viewers will be able to see how we think vaccine could become available over the weeks and months to come with the current vaccine supply that we have coming in. As more vaccine becomes available, people will become eligible in the following order: people who are 60 to 64 years of age, then we will move to people who are 50 to 59 years of age, then people who are 40 to 49 years of age, and then finally people who are 16 to 39 years of age. It's important to note we will not wait until we finish vaccinating everyone in that age range before moving to the next group. We want to continue to get the supply we need in order to have the assurance for going to the next group so that we can be as targeted as possible in ensuring that those at highest risk of hospitalization or death get access to the vaccine first. We expect vaccine to be available for people in the 65 to 74 age bracket in mid-February based on the current supply coming in. Please understand that how quickly we go depends on vaccine availability. More vaccine means that we would be able to get additional people vaccinated more quickly. As I said, the second consideration in this next phase will be whether someone falls into one of 5 high-risk groups, high-risk condition groups. So first, we're starting with age. We want to get going with administering vaccine, as I have just described. And the more vaccine we get, the quicker we will be able to accelerate, which is why we are choosing this approach. It allows us to move more effectively. We started with the first phase being very targeted and thoughtful, really getting at those who are at highest risk. And with this second phase, we're adding to our thoughtfulness and being targeted the ability to accelerate and expand quickly with the arrival of additional vaccine, which we are continuing to hope for and advocate for from our federal partners. So the second consideration in this next phase, as I just relayed, is whether someone falls into one of 5 high-risk condition groups based on their underlying illness. People who are 16 to 64 years of age who have kidney disease, heart disease, diabetes, lung disease, or who are immunocompromised will have accelerated access to vaccine. People who are immunocompromised include patients receiving chemotherapy for cancer. It includes patients on immunosuppressant medications due to organ transplants, and includes pregnant women. People who have kidney disease, heart disease, diabetes, lung disease, or who are immunocompromised will be able to be vaccinated at the same time as people who are 60 to 64 years of age. First, we have age, then we have high-risk condition groups. The last consideration in this next phase is geography. As we have talked about regularly at these press conferences, the residents of certain communities are at elevated risk for COVID-19 associated hospitalizations and deaths. Given that minimizing COVID-19 associated hospitalizations is critical to Rhode Island's ability to manage the pandemic and reopen the economy, vaccine distribution will be accelerated in these communities that are disproportionately at risk of more hospitalizations and deaths. Such communities include Central Falls, parts of Pawtucket, parts of North Providence, Providence, and Cranston. So how did we arrive here with this part of the plan? As I said earlier, our entire approach was developed based on the science and the data. Almost 2/3 of all our hospitalizations are among people who are older than 60, and 94% of our fatalities have been among people in this age group, older than 60s. So that's where age is their primary consideration. We also know that underlying health conditions have a lot to do with whether someone gets hospitalized for COVID-19. Looking specifically at our data, Rhode Islanders with kidney disease, heart disease, lung disease, and diabetes, and who are immunocompromised, are significantly overrepresented in our hospitalization data. For example, while 10% of Rhode Islanders have diabetes, 30% of people who are hospitalized with COVID-19 have diabetes. Similarly, while 2% of Rhode Islanders have kidney disease, 22% of people who are hospitalized with COVID-19 have kidney disease. The last consideration in our next phase is geography, as I've shared. The data here is clear. People in certain communities are at greater risk. It's not because of genetics, it's not because of anything particular to those individuals, it is connected to the environments and the conditions in those environments. Unfortunately, we have the example that the hospitalization rate in Central Falls is 67% higher than the statewide average. The hospitalization rate in Providence is 58% higher than the statewide average. Getting people in harder hit communities vaccinated quickly is the right thing to do. It's the right thing to do ethically, and it's the right thing to do to manage this pandemic most effectively. We all want things back to normal as soon as possible. We all want our businesses fully functioning, and we all want our economy back on its feet. The way that we do this is keeping our hospitalization numbers down. And the way that we keep our hospitalization numbers down is by vaccinating the people who we know are at greatest risk of being hospitalized. Something else to consider about our approach is that it is very broad. It captures many members of our various critical infrastructure occupations. Take teachers. Many teachers will get vaccinated early on using our framework that I've just shared. 58% of K through 12 teachers and staff are either 55 years of age or older, live in a community harder hit by COVID-19, or have one of the high-risk conditions that I discussed. This is important news. Although the data make clear that schools are not higher risk environments, we all recognize how important it is to get teachers and all Rhode Islanders vaccinated as quickly as possible. What we want to do is do it as effectively as possible given the supply that we have. Before wrapping up, I want to say one thing about treatment and one thing about testing. Those are our three levers that are critical for getting us through the remainder of this response: vaccinations, treatment, and testing. If you remember, we've said that these are the three things that are key, and we're making great progress in each of them. With treatment, Rhode Island now has a doctor-recommended treatment for COVID-19 that is fast, easy, and highly effective for people who have COVID-19. It helps keep you from getting sicker and from being hospitalized. Each of these levers are key to helping to keep people from having to go to the hospital. The earlier you start treatment, the better and more effective it is at accomplishing that goal. We've had strong results. We've already had more than 1,500 people take advantage of treatment, and we have ample supply left. If you test positive for COVID-19 and are 65 years of age or older, or have an underlying health condition, please call your healthcare provider and ask about treatment for COVID-19. If you don't have a healthcare provider, you can still get access. Go to covid.ri.gov/treatment to learn more. And lastly, a final note about testing. We're all excited about the vaccine, and we're very excited about treatment, but testing remains a critical part of the response. Testing is fast, it's easy, and it's free. There are same-day appointments on portal.ri.gov at sites throughout the state. This site, our team has stood up today our team has stood up brand new sites with capacity to complete 500 tests per day. There's one at the Lowe's in Cranston off of Route 10, and continues to be one at the Knights of Columbus in Middletown. Please take advantage of that. We talk about protecting your household. Testing, accessing treatment, and getting connected to vaccines is one of the best ways you can do your part to keep yourself healthy and safe, and to keep the people you love healthy and safe. That's how we will get through this together.